Ladies and gentlemen, please welcome the Vice President of the United States, Joe Biden, accompanied by Families USA Executive Director Ron Pollock and Kathy Stokes.
I told you this was a tough crowd. Mr. Vice President, dear friends and colleagues, welcome to Health Action 2014. The theme for our conference, and indeed the theme for our work ahead, is making the promise real. Starting this month, for the first time in our nation's history, the law of the land is that health care is a right, not just a privilege. For people who are sick or have a chronic condition or a disability, health coverage is now available as it is for everyone who is healthy. For families with modest incomes who can't afford health care, help is on the way. These legislative changes are enormous. They are truly historic. And we are deeply grateful, Mr. Vice President, for the effective leadership of the Obama-Biden administration that made this possible. All of us in this room, and so many of our colleagues who are not here today, are proud that we were foot soldiers in this historic effort. Like any major legislative accomplishment, however, there remains much to do. Our job is to take this historic legislation and make it a living reality for all Americans. In the words of a kindred movement that we celebrated earlier this week, we must keep on keeping on. So to help remind us about why this work is so important, please welcome Kathy Stokes, who will tell her own story about why the Affordable Care Act is so meaningful for her life, and will introduce the Vice President. Kathy?
Hi, everyone. My name is Kathy Stokes, and when I started my adult life about 25 years ago, I could not have imagined that one day I would own my own business, that I would be a mom, let alone a single mom to twins, and I could never have imagined that I'd be standing here before you this morning as a breast cancer survivor. This is my Obamacare success story. In 2006, I made the jump into self-employment to start my own communication consulting business. It was scary, but I was able to get health coverage through my husband's work, and we both thought it was as good a time as any to make the leap. And that was a really great plan right until my marriage ended at the end of 2010. At that time, I tried to get health insurance in the private marketplace, but I was denied due to some really very minor pre-existing conditions. However, I was eligible for COBRA benefits from my ex-husband's job, so I knew I would have coverage for 3 years. Well, fast forward to 2012. I found a lump on my breast in late August. And several days and many tests later, I was dumbfounded to hear my diagnosis. I had breast cancer, and it was aggressive. What followed was a whirlwind, a double mastectomy at the end of 2012, 5 months of chemotherapy, and a year's worth of antibody infusions starting in January 2013. I lost my appetite, my hair, and at times my will to keep going. But anytime I faltered, my twins, Kaylin and Aiden, were there to give me the push I needed to get to that next day, to get through that next phase of treatment. In July, I had breast reconstruction surgery, and then a few months later, I learned that the antibody infusion I had been getting caused heart damage. Now, the good news is that the damage is reversible, but it requires regular visits to a cardiologist and echocardiograms and 2 different heart medications for now. This was not a good time for me to lose my COBRA coverage, but I did on December 31st, 2013. But because of Obamacare, I am happy to say my new coverage began the very next day on January 1st, 2014. Now, with Obamacare, insurers couldn't deny me because of my breast cancer or the temporary heart condition I have. My premium is affordable because I was able to get some tax credits. And that $8,000 antibody infusion I got on January 2nd was covered in full by my health insurance. Now, I am absolutely thrilled to report that my last infusion is tomorrow. Thank you. And the port that I wear to get the infusion through is going to be removed next week. So my cancer odyssey is nearly over. But without Obamacare, 2014 would have been a disaster. No insurance company would have taken me on. But with Obamacare, I started this new year with great hope. I am an Obamacare success story. I'm my own success story too. Thank you. And now, ladies and gentlemen, the Vice President of the United States.
Kathy, thank you very much. What an inspiring story, Kathy. Even with the Affordable Care Act, Obamacare, it's a rough road. Even with totally adequate health care coverage, it's a rough road. And your courage is amazing. And you're an inspiration, and you really are. I hope women who are now all covered, but with breast cancer, get a chance to hear your story, because I'm going to repeat this again, but one of the things Ron and I believe, and we've been doing this a long, long time, he's been doing it much more than I have, is that it's not just about physical coverage, it's about peace of mind. It's about being able to turn to your twins and say, honey, it's going to be okay. When Ron spoke, I was reminded of something I haven't thought about in close to 40 years. Ron's been in this fight for as long as I can remember. And for us to be able to say in a hotel auditorium in Washington, D.C., without any fear of being contradicted, that health care is a right, not a privilege, is amazing for you and me. because that used to be the fight. Just that alone. Did people have a right? Oh, they had a right to public education. They had a right to be safe in the street. But somehow our opposition thought somehow this health care thing, it's not a basic human right. And Ron, no one has carried the fight like you personally have. Inside in this organization, outside the organization. Obviously, Phil and Kate, the founders of Family USA, have carried the fight. But you've been up in the trenches making this fight. And I was reminded that I got elected to the Senate when I was 29 years old. And I come from a state that has a lot of major corporations and a lot of responsible major corporations. And I come from a state that, although everybody calls it blue now, was fairly red at the time. And I remember what I would do every year. I would go to all the major constituencies. I would sit down and I'd meet with the Chamber of Commerce. I'd meet with the AFL-CIO. I'd meet with the United Auto Workers. I'd meet with the NAACP. I'd meet with, at the beginning of the year, and I met with two of the largest companies, the CEOs and their boards in the state of Delaware, and there are Fortune, at that time, 10 companies. And I would listen to what their concerns were for the coming year, across the board. Business, labor, activist groups, et cetera. And I was in the boardroom of one of the major corporations, and everyone was being very nice except the CEO. And he was really just, he was upset with me. I'd forgotten this until you started talking. And I was sitting to his right, and I finally said, because he was being close to rude, I said, Mr. Chairman, what's your problem? I know it doesn't sound like me. I've always been very pliable. And anyway, I said, Mr. Chairman, what's your problem? I said, if I'm not mistaken, you invited me here. I didn't ask to come here. And I said, what's the problem? And in a burst of honesty, he looked at me, he said, you know, he said, all you're going to do is go down there to Washington and work with Teddy Kennedy to try to get health care done, a socialist program. And I thought of that. I hadn't thought of that. That's the God's true story. I hadn't thought of that in close to 40 years. But because of you, Ron, and your troops, we're not arguing about whether it's a right anymore. Even the Republicans don't use it in their rhetoric that it's not a right. They say they want it, they just want it better, although I haven't seen it yet. So I just want to personally thank you, man. You were there when Teddy was fighting for Chip. You were there. I mean, you've just been there. And so, folks, you owe this guy a round of applause. Folks, I came for 3 reasons. One, I wanted to. 2, the president wanted me to. Seriously. You check, you are going, aren't you, Joe? Even though there's a national security meeting right now. And 3, on behalf of the president and me, just to say thank you. Just thank you. Thank you, thank you, thank you. You have been the ones who demanded a fair shake for millions of families who, like Kathy, paid hard-earned dollars in health insurance, only to find that their premiums were going up 15% a year. And benefits were disappearing at the exact moment they wanted them because of annual caps. You were the voices that said it's not okay for someone like Kathy, who worked her whole life, started a business, paid her premiums on time, raised her family, to be left without insurance at the moment she needed it most, where it was literally life and death. You've been working for decades, this organization, some of you are very young and you've not been around for decades, to improve health care for tens of millions of Americans. You fought for the Patient's Bill of Rights to make sure that health decisions were made by doctors, not by insurance companies. And because of your leadership, it was included in the Affordable Care Act. You fought for programs to help lower copays and premiums for Medicare beneficiaries with low incomes. And we're talking on the way in when Newt Gingrich wanted Medicare to wither on the vine and Medicaid to be block granted. You were there because you knew it would result in kicking millions of pregnant women and children, millions of seniors, middle-class seniors, in nursing homes because they had no one else. They were alone, kicking them off of coverage. You stood with Teddy, built a national fort for CHIP. You welcomed then Senator Obama here in 2007, where he pledged his commitment to make health reform a reality. And he did. He did. I get credit. He deserves all the credit because I was with him every minute through this bitter fight, at least a half a dozen times when he could have compromised. And what he would say every time, he'd say, Joe, if we let this go, it'll be another generation before 24 million young people, mostly of color, but poor, will ever get the kind of coverage that they need. I think every one of you around this room, whether you were sometime in your life fully insured or underinsured or had no insurance at all, you have a story of your own. I'm sure, like me, you have stories of family members and close associates, high school, college friends, your neighbors. Those of you who were fully covered might remember what it felt like, the relief it felt like if you knew someone or you yourself had a catastrophic illness befall you. I was hospitalized for 7 months with 2 cranial aneurysms, not given a good shot of living, and I was given not quite an even shot, a less than an even shot. And I spent 60 days in ICU because of a major embolism in between those craniotomies for my aneurysms. And I can tell you what I remembered, like a lot of you, like I suspect Kathy did. The one solace I had, even though my bills exceeded well over $500,000, I had insurance. But I remember willing out, what would have happened to my family had I not made it, and I'd not had insurance? Ladies and gentlemen, again, for me, speaking for me, a big chunk of why I so strongly believe it's a right and we're covering it now is peace of mind. Peace of mind. Mark my words, I spend a lot of time with our scientists and the PAB board and all these Nobel laureates about the future and medical breakthroughs that are coming. You're going to find, this is Biden, I'm a lawyer, not a doctor. But I bet you're going to find by the time you're my age that, in fact, they've discovered stress plays an incredibly, incredibly dominant role in your health care, in your health and your immune system. So don't underestimate the peace of mind piece of this. You know, the fact is that in addition to worrying if you had a catastrophic event, whether or not if you didn't have insurance, what would have happened to your family, you also find that how many times have you thought to yourself when you were moving along that, you know, all the people you've met who don't have insurance, how many people do you know or know of, and I mean personally now, who literally went bankrupt because of their medical bills? Single greatest reason for bankruptcy. Went bankrupt, which means they lost their homes in many cases, all their savings, if they had any. How many of you thought in the last 10 years, there but for the grace of God, there but for the grace of God? I assume That's what motivated all of you in this room. There's a lot of public interest questions that are out there that people get engaged in because the intellectual excitement about it, and it matters. But I find that people get involved, and you've been involved in, get involved in it emotionally as well as intellectually. I suspect that's what made you determined to see the system change. So the horror stories you've heard and witnessed would not continue. And what you all did, unlike most groups, you went out in the field. You knocked on doors. You changed people's minds. You argued unabashedly. Every American has a right, a God-given right, to have adequate health care coverage. And in the process, you helped pass the most consequential health care bill in American history, something presidents from Teddy Roosevelt to Franklin Roosevelt, John Kennedy to Richard Nixon tried to do. But I guess it's because they didn't have you. It didn't get done. There's an old expression. The greatest gift God gave mankind was the ability to forget. But right now, it's important to remember. It's important to remember what it was like immediately before the Affordable Health Care Act. We've already sort of dismissed it, like, it's done. A lot of Americans were in pretty good shape, particularly those who work for large companies who provided and still provide decent health care plans as part of their compensation. They were by and large in good shape, but even there were hidden costs, hidden vulnerabilities. Even these families were paying higher premiums, in part because hospitals were necessarily passing on $40 billion a year in losses they incurred every year for having to treat uninsured people or underinsured people. Just to put this in perspective, the average cost of one visit to an emergency room, which is, by the way, the only recourse for poor moms and dads when their kids have something wrong with them, even something minor. They have no doctor to call. They have no doctor to call. What'd they do? They go to the emergency room. That's the constituency I've represented my whole life as a public defender, as a lawyer, as involved in the civil rights movement. That's where they go. That's their doc. Average cost for outpatient is $1,200 a visit. $1,200. That adds up to tens of billions of dollars. There was an article recently saying even people now covered by Medicaid are still going to the emergency room, as if that's something weird. The truth is, many of these people never knew a doctor other than the emergency room. They don't know even how to manage the system which covers them. Emergency people are rooms for trauma and where people go when they don't have insurance, when their children get sick. Even some of those so-called good plans faced annual limits in health insurance policies. So when you really needed it, extended Alzheimer's treatment, or as Kathy spoke about, the extended need she needed for her treatment for her breast cancer, or extended treatment for surgery, they weren't covered. But those who were self-employed or in small businesses, they didn't fare nearly as well. They didn't have the clout to negotiate a good deal with the insurance companies. They did not have the negotiating power. And so what happens? When you go in and you represent a company that employs 300,000 people, you can say to the drug company, I'm not going to pay, I'm making the number up, a penny an aspirin. I'm only going to pay 3/4 of a penny an aspirin. Now, if you don't want my business, I'll go somewhere else. But you go in, you're a small business. You go in as an individual or with 10, 20, 30 employees, say, I'm not going to pay a penny an aspirin. They say, no, you're going to pay a penny and a half an aspirin. No bargaining power. It's still a marketplace. So instead of walking in and saying, as I said, I represent 250,000 people, and say I represent 3, there is no negotiating power. There was no negotiating power. And the same plan covering your employees was considerably more important as a small business, more expensive than the same plan covering the large business employees. But as all of you know, the toughest market has been the individual insurance market. 70% of the adults lacking insurance with pre-existing condition problems found when they tried to buy coverage that it was either difficult or virtually impossible to find an affordable plan. 129 million people have pre-existing conditions here in the United States. Many were covered by their company's health care plan or were covered before in another plan, covered before when they didn't have a pre-existing condition. And what did you see in the manifestation of this Great Recession? As companies downsized, as companies went bankrupt, as employment dropped off like a rock off a cliff, what happened? All of a sudden, these people who were covered before, who in the meantime had acquired a pre-existing condition, are out on their own in the individual market. I won't take the time because you know as well as I could give you at least 15 stories of people I know personally or have come to know who are devastated. Even people with real income not being able to afford a plan because the cost is prohibitive. And by the way, until we came along, pregnancy and domestic abuse were listed as by insurance carriers as pre-existing conditions. But you helped us change all that. Insurance companies can't do that anymore. Women can't be discriminated against anymore. In the past, they could be charged just because of their gender and being of a childbearing age as much as 150% more than the man recovering the same, getting the same coverage and the same plan. Again, prior to the ACA, 20% of those who were able to purchase individual health insurance were not able to purchase a plan that covered prescription drugs. Many plans also don't cover maternity care, mental health services. I've been doing this for a long time. I can tell you, and I'm sure you've experienced the same thing I have, how many people, including some of my closest friends from high school and college over the past 30 years, have climbed into bed at night, turned and looked at their spouse, and then stared at the ceiling, literally stared at the ceiling, thinking, my God, what happens if my wife Kathy gets breast cancer? What happens? What happens if I have a heart attack? What happens if my son or daughter gets gravely ill? Will we be able to sleep in this bed, in this room, in this house, a month from now, 2 months after that, 3? That's not a scare tactic. That's how real people had to think about it. Part of our objective, as I said, is not only to make sure you have adequate health care, but to give people peace of mind. For a mom or a dad to be able to turn around and say with confidence when they look in their child's eye when they're sick and say, honey, it's going to be okay. Just be able to say it with certainty. It's going to be okay. And so many parents, so many families, up to now, have not been able to turn and say, it's going to be okay. These people, our people, the people we grew up with, these people needed a voice, and you've been that voice. And you still are. I don't think it's an exaggeration to say that because of your voices, these people are in much better shape because of the Affordable Care Act. You not only made the case generally, you organized. You got people out. You organized rallies. You helped Republican governors in places like Arizona, Iowa, Michigan, Ohio, and others to take advantage of the Medicaid program expansion. That's a big deal. You armed the state organizations with facts to counter the noise. You organized teleconferences. You collected 20,000 stories about real lives and got them out to the media. You generated stories in hometown newspapers all across America. You changed the conversation, and I'm here to say thank you, thank you, thank you, thank you. And if Republican governors in the state legislatures in the states of Texas and Florida, North Carolina, and others would act responsibly, we could immediately cover another 5 million people with a stroke of a pen. Three years ago, a man who has more character in his little finger than most people I've met having their whole bodies spoke at this conference. His name was Senator Barack Obama. He said, change does not come from the top down, it comes from the bottom up, and you guys activated the country. Well, you did activate the country, and you got it passed, but you got to stay at it. We still have a long way to go. We still have a long way to go. Got off to a rocky start. But enrollment is up. 2.2 million Americans have selected private plans in health insurance marketplaces. And I think you're going to see with the release of figures at the end of this month, it's much higher than that. And based on new data released yesterday, more than 6.3 million Americans were determined eligible for Medicaid in the past 3 months. Now, to be fair, to be totally honest, not all of these folks are new to the Medicaid program because some already qualified before the passage of the act. But 6 million people, I asked them to disaggregate how many would not have been covered but for. We don't have the ability to do that at this point. But they all have peace of mind that comes with high quality health insurance. And as you well know, some states have not taken that opportunity to expand Medicaid under ACA, even though the federal payment at the front end is 100%. And as I said before, if the states that haven't acted would just act now, 5 million more would have access to affordable coverage. But as surprising as it may seem, after Republicans in the Congress have voted to repeal the law 40 times, they still haven't given up on their message. After a disastrous effort of shutting down the federal government, they didn't get the message. And I'm confident they're not going to get the message I'm about to deliver to them. But here's the message. We will not go back. We will not go back. America has turned a page. We will not go back to the days before the Affordable Care Act when pre-existing conditions were a barrier to coverage. We will not go back to the days when mental health was not covered. We will not go back to the days when women could pay so much as 150% more than a man for the same coverage. We will not kick 3 million young adults off their parents' policies. We will not go back to the day when patients lying in a hospital bed, fighting for their lives, are told that, sorry, your coverage is over. We cannot cover you anymore. We will not go back. America will not go back. So let me close. Let me close by saying once again, thank you for what you've done. Thank you for what we're going to need you to do. And as my grandpop used to say every time he'd walk out of his house, his name was Ambrose Finning, he'd say, Joey, keep the faith. And my grandma would yell, no, Joey, spread it. Spread the faith. God love you all. May God bless and protect our troops. Thank you.
Thank you, Mr. Vice President. We will have a brief intermission, and then we'll carry on with the program. Thank you. Has many impressive accomplishments. He is leading significant efforts to improve educational attainment across the age spectrum. He led a voter-approved referendum that will expand pre-K services to more than 22,000 San Antonio 4-year-olds over the next 8 years. Under his leadership, the city established Cafe College, a one-stop center offering high-quality guidance on college admissions, financial aid, and standardized test preparation, and since its opening in 2010, it has served more than 25,000 area students. During his tenure, San Antonio has ranked #1 in the Milken Institute's Best Performing Cities list and graded A+ for doing business and ranked as the nation's #3 new tech hotspot by Forbes magazine. Our interest in hearing Mayor Castro is because Texas has a bit to catch up with respect to health care, and he certainly is helping that happen. Texas, as you know, has ranked near the bottom, at the bottom, in the portion of the population that is uninsured. Hispanics constitute the largest demographic group that is uninsured, and yet Governor Perry has so far rejected the Medicaid expansion and refused to implement a state exchange. We're thrilled that Mayor Castro is here because while Governor Perry has rejected helping the Affordable Care Act, the mayor has been extraordinarily helpful and doing everything in his power to get uninsured people enrolled in the San Antonio and Bexar County area. And he is an outspoken supporter of getting the Medicaid expansion. So please welcome a good friend, Mayor Julian Castro.
Thank you very much. Thank you very much, Ron. And first of all, let me echo Vice President Biden's sentiments in giving you a huge thank you. Muchísimas gracias for the wonderful work that you and Families USA have done over the years as advocates, as proselytizers, as folks who have helped ensure, as the Vice President and as you have said, that now something as basic, as humane as healthcare is a right in the United States of America that everyone can get. So congratulations. And thank you all very much for having me. You know, when they told me that I would come on after the Vice President, I said, what? Said, first of all, half the folks are going to be gone from the room. And then I heard the Vice President speak, and he was hitting it out of the park, like grand slam after grand slam. I said, oh man, you're really in trouble. But I just wanted to come here today and to share a few thoughts with you from a couple of different perspectives. Before I do that, though, I wanted to give a quick shout out to my state senator, who is also on the board of Families USA, State Senator Leticia Vandepute, who I know is here today. I want to thank her for her great work. We're hoping she's going to be the Lieutenant Governor of Texas soon. I know that we have a lot of folks from different places. Who's from California? All right. What about New York? Anybody here from Florida? How about Arizona? How about DC? And finally, Texas. Where's Texas? All right. Well, you know, there are a ton of things that Senator Vandepute and I are proud of about Texas. We were both born in San Antonio. We grew up there. It's 68 degrees over there right now. It's a beautiful state, an aspirational state. It's blended over the generations this ethos of hard work and independence, but also blended cultures and philosophies and religions and outlooks. And today it's one of the most economically prosperous states in the United States. It's growing tremendously in cities like Houston, Dallas, Austin, the cool city in Texas, and San Antonio are prospering in many ways as well. I had the chance after I graduated from high school to go away from San Antonio for college and for law school, and then chose to come back to Texas. And so I love the state. There's a lot to be proud of. But one of the things I'm not proud of is that Texas, as you know well, has the highest rate of uninsured adults and of uninsured children in the United States. About a quarter of our folks in Texas don't have health insurance, and more than 17% of children do not. For Hispanics, for instance, that number is even higher, closer to 38%. In Texas, there has been prosperity, but there have also been many people left behind, and folks who are being left behind. And I wanted to come and share with you the perspective of someone who is in the trenches where not everybody is getting to take advantage of that right that health care is and ought to be, but a place where we're working hard to make sure that Texas is like the rest of the United States. You see, as a mayor, one of the blessings of the job is that we get to see the people that we represent every single day. People call City Hall about all sorts of different things. If a dog is barking too loud at their neighbor's house, if they ran over a pothole and it messed their car up, if their electricity is off, or if the weeds across the street are too big. We go to neighborhood association meetings and sometimes to PTA meetings and get to visit schools and hospitals and get to talk at a very basic level and to hear the stories and the concerns and also the dreams and the aspirations of the folks that we represent. And I can't tell you how many times over the years I have heard the stories like the ones that the Vice President shared and that Kathy shared earlier of folks in a panic because they don't know what they're going to do. They're making a choice between going to see the doctor or saving what they know will be the expense for something else, whether it's their rent or providing for their children or tuition. And we know that at the local level, because of that connection, we also have the power to do something. And so in San Antonio, like in many communities across the nation, communities that y'all are working in, we have made it our business to ensure that the Affordable Care Act succeeds. We've mobilized our 311 responders, trained them so that when someone calls in, if they have a question about the Affordable Care Act, they can give them basic information and tell them where to go to get more. We've got 26 public libraries in San Antonio. We're a city of 1.3 million people now, the 7th largest city in the United States. And at every one of those branch libraries, we have information about the Affordable Care Act, and we have a terminals that they can go to, computers to get enrolled. We've supported the efforts of nonprofits and navigators who are getting out there and going door to door to let folks know the opportunity that they have to finally have good, affordable health care. We've enlisted our first responders, the ones who make those 911 calls, the ones who are on the other end of the fact that, as the Vice President said, for many folks, the emergency room is their primary care physician. And so we're ensuring that folks have the information they need. You see, for the city, it's about ensuring that people have the opportunity to live a good life. It's also about the bottom line. We have tens of millions of dollars in San Antonio in unpaid EMS costs because folks can't afford, when they call the EMS, to actually pay the bill for that transportation. I also look at this issue as someone who this year is going to turn 40 years old. I know, I'm getting old. I have a twin brother, Joaquin. He's the one in Congress. He says I'm a minute uglier than he is. When I was growing up, I knew that he had been born at 2:41 in the morning and I was born at 2:40. So when we were growing up, I would wake up at 2:39, and for that minute between 2:40 and 2:41, I would tell him that I was older than he was. Now, I wish I could say I was younger. This country developed into a great nation because folks had the liberty to pursue their dreams if they were willing to work hard, to aspire, to keep reaching for greater things, but also because as a United States of America, we made a commitment to each other to ensure that there was a basic level of opportunity, a ladder of opportunity for people to climb to reach that American dream. We came up with Social Security and Medicare and the GI Bill, ways that folks are able to ensure that they could get a college education or that they wouldn't go broke in their older years. And what I see is America at a crossroads. For the last 30-something years, we've been going in one direction, looking more and more inwardly at ourselves as the universe of what counts. This Affordable Care Act, this Obamacare is so important because its passage and its success and your commitment to its success says that the United States is still the United States, that we are still all in this together as a community that cares about one another. And each and every one of us has a reason for why we support getting folks health care. For me, it was that I grew up with a grandmother who, for my entire life, when I was in the household and until she passed away when I was 21, she had diabetes. And so when I was young, she had these injections that she had to take every day. The thing is that she never did the injections. She used to eat tamales and enchiladas, and she used to drink Old Milwaukee beer and Coke and Big Red. But I remember that a week before she passed away, she had one of her legs amputated. And being in the hospital room with her and her realization of that, and of course I remember thinking that that was no way for someone to pass away at the end of their life. But I also remember thinking, being in that hospital room after she had gone through years and years of care, what in the world it would have been like if she hadn't gotten the care that she did get. She at least had, by that time, Medicare. And I come from a community where her story of folks who develop diabetes, hypertension, stroke, is so common. Every single family in San Antonio, just about, is impacted by it. And we want for every single family to have the opportunity so that their loved one can live out their golden years productively and like they want to. And the only way that that's going to happen is if we fight for this Affordable Care Act and we make sure that it's a success, that we don't turn backward, but that we keep pressing forward. Because I have no doubt in my mind that just like today we do with Medicare and with Social Security, that a few years from now, all of us are going to applaud the success of health care. And whether people are conservative or liberal, Republican or Democrat, they're all going to say how much they think it's a great idea. They're all going to try and take credit for it. A few years from now, the Republicans are going to say, well, you know, we made it better. But there is a lot of space between here and there. And so I wanted to come here today and to join the chorus of saying thank you to you and to ask you, to challenge you to keep fighting. In states like Texas, we still have 1.5 million folks who are not benefiting because Governor Perry refuses to expand Medicaid. We still have millions of children and families that don't have access to quality, affordable health care. We still have state legislators that are so intent on thumbing their nose at President Obama that they won't listen to the reality of the health care needs of the families that they represent, or the chambers of commerce who are begging them to expand Medicaid, or the hospitals that tell them what sense it makes to do that. They've thrown up roadblocks like trying to block the navigators from doing their jobs, threatened lawsuits, running in primaries, trying to see who can be least for the Affordable Care Act. You know, it's something that is worth laughing at if it really weren't so sad. Because that's not the America that we are. That's not how this nation became great. We became great not because we didn't care about each other, but because we do. This organization and the organizations that are represented here, I know, have been part of the broader American story of ensuring that we create opportunity by extending opportunity to everyone. And so thank you for the great work that you already have done, the work that you are doing, and to the moment that is coming in a few years, hopefully sooner, when we will celebrate success and call the Affordable Care Act in Obamacare a great victory for every single American. Thank you very much.
Thank you, and thank you, Senator Van de Putte, for helping the mayor join us today. Much appreciated. Our next speaker, the lights are pretty high, so I'm not sure I can see folks, but I'm sure he's here. It is my pleasure to introduce a friend, Ezra Klein, who is an excellent journalist, one of the leading social thinkers in America. Ezra, who's not yet quite 30 years of age, has already had a very distinguished career. He was formerly an associate editor of the American Prospect political magazine and a political blogger for it. At the Washington Post, he has managed a branded blog called Wonk Blog, which includes thoughtful blogs about health care, budget policy, and politics. His blogs have received significant and well-deserved commendations. In 2011, he was the most read blog at the Washington Post. He has been named one of the 50 most powerful People in Washington by GQ. Now that's an honor. His blog was named one of the 25 best financial blogs by Time magazine. And last year, Ezra won the Online News Association's award for Best Online Commentary. Ezra's thought-provoking commentaries appear in many places. He's a columnist for Bloomberg News. He frequently provides commentary in MSNBC for The Rachel Maddow Show, Hardball with Chris Matthews, The Last Word with Lawrence O'Donnell. And soon he will start a new media venture. I don't think you're going to announce it here today, right? With several other veteran journalists. Ezra has written extensively about health care, the Affordable Care Act, and the political context in which all of us are doing our work. We thought as we opened the conference, it would be stimulating to hear Ezra's thinking about where we are today, about health care in America, and his thoughts about the substantive and political future for the work we are all doing. So please give a good welcome to a friend, Ezra Klein.
How's it going, healthcare nerds? Ron, a couple months ago, asked me to speak at the conference. I thought, great, because I've been coming to this conference for a long time. What an honor. It'll be very, very exciting for me. And then he said, and you're going to follow Kathy and Vice President Joe Biden and Mayor Castro. And I thought, a trap. Jerk. Okay, I'm the guy who comes on after the politicians, and that's actually not a bad thing to have them out of the room for this part, because one of the things I'm here to tell you today is that the time for national politicians, the time when Obamacare was about what national politicians did and thought and said and felt, is over. I have a lot of conversations about Obamacare for my sins in Washington. And when people in Washington say, will Obamacare be a success? When you hear that, like on the news or people are talking about it, what they typically actually mean is, will Democrats pick up seats in 2014 midterm elections? And when Republicans say it's going to be a huge failure in sort of limited ways, point to polls, different things, at this point what they typically mean is Democrats are going to lose a bunch of seats in the 2014 midterm elections. And it's because in Washington, we set our clocks, we set our watches by the elections. It's the only thing anybody cares about. Everything is some kind of input into an election, and it matters insofar as it affects the output of that election. But you may know, I don't wear a watch. The time when this law was a political abstraction is over. And I actually don't think even Washington, but very much the country, has totally cottoned on to how fundamentally the politics and the task of the Affordable Care Act have now changed. This law, as of 6 months ago, was a political abstraction. It's something we argued about here in Washington. It had done some things of consequence, you know, like letting folks up to age 26 beyond their parents' plans, but it was a political abstraction that we argued about in Washington. It was something Mitt Romney and Barack Obama argued about. It was a symbol of, whether you're a Democrat or whether you're a Republican, it was a symbol of socialism or compassion. It was a symbol. And all of a sudden, it's not a symbol anymore. All of a sudden, it is a real live law. All of a sudden, there is an actual website that you can sometimes go to and buy health care on. All of a sudden, there are actually people who are going to the doctor and not using something anybody ever calls Obamacare, right? It's called Medicaid, or it's called Aetna, or it's called Covered California. It's never called Obamacare. But all of a sudden, people actually go to the doctor and they get seen, and in some cases, their lives get saved by something that was done by Obamacare. And so now the question is not about who wins the election, because I get it, midterm elections matter, but there's a point at which you want to say almost who cares, right? We'll see who wins the election when we see who wins the election. But this task now is about actually making the law work. And the nature of that has really changed. When I talk to people about the politics of the Affordable Care Act and how it's changed, the two main things I try to get people to focus on are the timeline and then status quo bias. I don't think people think super clearly about the timeline of this bill now. For the next, we got a midterm election coming up, but for the next 3 years, until January of 2017, Barack Obama is going to be president. And if he decides that he's tired of all this crap and he's going to Hawaii, then Joe Biden's going to be president. And you heard Joe Biden earlier. He's not repealing the Affordable Care Act. He's not gutting, he's not taking out the individual mandate. So there is no major change that is plausibly going to be made to this law for 3 years. That is a very long time in American politics. That is a very long time in the implementation of a bill. A lot of people in this room will actually remember Medicare Part D 4 months after launch. It wasn't working so good. And yet 3 years later, it is a pride and joy achievement for the Republican Party. It is what they say their future healthcare policies or future Medicare policies will all be based on. The Republican Party, over the last couple months, actually did find a kind of a purchase on attacking Obamacare through something that is a very powerful mechanism in American politics, and a very powerful mechanism, frankly, in human being psychology, which is people don't want to lose what they have. They do not want to lose what they have. And when Obamacare was canceling plans for some people, when people at least were saying it was going to make some people change their doctor, when it seemed like it might make people lose what they have, they got real scared. And rightly so. There is nothing more personal than healthcare, nothing more personal than the ability to be certain that your daughter or your son or your wife or your husband can see a doctor when they need. And having the government come in and potentially take that or change that is terrifying. The Affordable Care Act is now ensuring, depending on how you want to run the estimate, somewhere between 6-7 million people. By the end of March, I think it's pretty plausible to be more in the 10 million range. By the end of 2014, and by March 2015, when the individual mandate gets even worse, what are we talking? 13, 14, 15 million people? You really think someone's going to get elected in 2016 and then come in January 2017 and start the Chris Christie insurance cancellations? The Paul Ryan, no one has health insurance anymore policy of 2017? No. This is the beginning of reform. It is not the end of reform. But it's also not going to be the end of reform. This is a different conversation now, even if we haven't begun having it yet. This is a conversation that is going to become about how to make this work best for whatever value of that you hold, as opposed to whether or not it should exist at all. There was an Onion article yesterday. Y'all read the Onion? It said, "Nation recalls simpler time when healthcare system was broken beyond repair." And it's totally correct. That was a simpler time. It was way easier to do this. I can tell you, I had to call way fewer state capitals. It was way easier to do this when our healthcare system just sucked. You could get your hands around that. It is intellectually straightforward to be hopeless. It's difficult to have hope. This is going to be a complicated process. Anybody who thinks this law is or should be preserved in amber going forward hasn't taken a hard enough look. So this is going to be the beginning of not just making this law work, but then building on it. It is a platform. It is something where we need to learn what works and what doesn't. We should have the humility to know it is something where we will need to learn what works and what doesn't, and then knock out some things that we were committed to, and then build up some that we didn't really think were going to be part of it at all. Right now, the first thing, the proximate challenge, is enrollment. And we're all worried. We're all worried in the press and in politics about young, healthy, rich people signing up on a website. We have managed to create a political conversation on healthcare that is most concerned with the people who need the least help. It is a phenomenal achievement. Ron mentioned I'm about to go out and do my own thing, or go out and do something a little bit different. And I'd like to have healthcare when I do it, and probably will. But you know what? I assure you, you do not need to be making your healthcare policy primarily for me. Like, I am not the person that American politics needs to be most concerned about here. I get the economics of it, but it is morally backwards. The proximate challenge, in addition to signing up a lot of young folks, because economics of that matter, but we in Washington, we're not thinking about the older, poor, sicker Spanish speaker who doesn't have a computer at all. We've just stopped worrying about whether or not sick people, people who are on more of the margins of society, are going to be involved in this law at all. There was a thing happening the other day in Congress where there were a couple congressmen who were upset, who were angry that the law was going to cover convicts, ex-convicts who just get released from prison, sick ex-convicts who just get out, and we don't want them turning back to crime, and they're upset that they're going to have health care, and so one of the reasons that they might have to turn back to stealing things to pay for going to the doctor is going to be gone. It's going to be folks like you guys who are going to have to worry about the people we need to help most. It's going to be folks like you guys who are going to have to worry about going out to communities where the problem isn't that the website is broken. The problem is that the people don't have a computer. And it's going to be you guys who have to go out. And it's going to be you guys who have to go out and deal with the folks who, for reasons, honestly, that like I find I am powerless to understand, that we've begun to think of them signing up as a failure of healthcare because they might actually need to use some healthcare. But somebody is going to need to be looking out for them, right? Because it's not going to be the insurers advertising to them. And by and large, it's not going to be even the politicians who are pro-Obamacare going out and targeting campaigns at them, right? They're all worried about the young and healthy people. But it is not a win. It is not a win in healthcare policy if we get every healthy 35 and under in the country and all the people who need healthcare tomorrow are left out. So there is a now challenge. There is a proximate challenge. There is a today and a tomorrow and a Saturday and a Sunday and a next Monday challenge of actually making sure that people who need to be enrolled are enrolled. And that's going to fall to the people who have been caring about them for a very long time, not the people who are worried about who wins in 2014. At some point, you guys are going to succeed in that. At some point, these folks are going to be enrolled. And then medium term, long term, the thing that we all talk about in DC is cost. The thing that we all talk about is, I mean, it's called the Affordable Care Act. Actually, we drop the patient protection part of it when we talk about it. Forget the patients. How much is it going to cost? And look, cost is important. I don't want to pay too much. But I do want to change this discussion a bit about cost, because I think it's important to not have like an insane approach to this. Let's imagine a world in which American healthcare costs exactly what it does now, which is a god-awful amount of money. But what we get out of that is we all live healthy lives for twice as long. I'll take that trade. Hell, I'll spend more for that trade. In healthcare, for some reason, we talk enormously about cost, and we don't talk about value. But value is what matters. Value, how much we're actually getting for the dollar, matters a lot. And it is the only way to make sense of the question of cost. I got an iPhone here. And it costs more than a flip phone. It costs more than a phone that can't tweet and probably is worse for that reason. But I paid more for it because it had value to me. That's how we do everything else in life. We don't just say, well, what is the cheapest thing? We ask ourselves, what is the thing that's worth having? Cost is a wrong measure. Value is the right measure. And value is what happens when you take cost and you divide it by quality. Value is what happens when you take cost and you divide it by quality. And so I don't see the medium and the long-term challenge here as just somehow cutting costs, because I can tell you how to cut cost. I can tell you how to charge people more so they get less care. I can tell you to close down a bunch of hospitals. I can tell you how maybe nobody can have health care on Tuesdays. We'd save some money. Bring costs down, we bend the curve. What about no weekend health care? Bend that curve. We should care a lot more about quality, and for another reason that is both real and political. You guys know the number, right? 85% of the folks have insurance. The most salient fact about American healthcare, both in its politics and in its reality, and in how it's practiced day in and day out, is not that 15% don't have insurance, but that 85% do. Because those people, they're coming in and getting healthcare too. They are moral agents. We need to care about them. And the win for them, the thing that's going to matter for them, because the Affordable Care Act and what's going to come after the Affordable Care Act is not giving them health care. That's not what it's doing. And it's going to bring down their costs, and I think that'll be important, and I think that will work, against a baseline, so it's not going to feel like costs are going down. But that's not the key win either. The thing that matters most for them, the reason they're buying this expensive insurance in the first place, is the idea that it might save their life, or the idea that it might keep them healthy, or save them from pain, or save them from disability. And what's going to matter, what's going to be the real question about whether or not this bill did a good job serving them, and whether or not what happens after this bill does a good job serving them, is when they go into the doctor, when something goes wrong for them, are they likelier to come out well? Are they likelier to come out healthy? And if we get that quality approach right, if we are able to build on this platform in which people have health care, in which the system is more integrated, in which we're bringing down readmissions, in which we're actually getting evidence on what works and what doesn't, in which insurers and Medicare and others are beginning to pay based on value and based on quality, if we can get that stuff right enough that we actually make people's care better, that we actually increase the value proposition of having health insurance, that ultimately for everybody, for the people insured now and the people getting insured now, that ultimately is what makes all this worth it. Because a little bit behind this conversation is something a lot of you guys know, which is we just don't get enough for our money. That our insurance for how much it costs us, our health care for how much it costs us, is not as good as it needs to be. That mistakes are too common, tough treatments that hurt people without enough evidence to back them up, except for evidence of how it actually helps the bottom line, are too common. And good people trying to do the right thing, but just not having the knowledge base to know what the right thing is just way too common. And people get hurt by it. When you get the wrong treatment, when you get something that you didn't need to get, and then you get a central line infection, people get hurt by it. So I'm not somebody who believes that the long term here is all about cost. I'm somebody who believes that the long term here, after we get folks insured, is making sure that when they do get sick, that they're getting better. And that too is going to be a long and aggressive campaign, and it's not going to be an easy one because the people who are getting hurt aren't always visible, and the politicians aren't ready to talk about it. And in Washington, all anybody wants to talk about is how much we're paying and how we could possibly be paying less. But they're going to need over time for the folks who understand this stuff, which is you guys and others, to be pushing for a smarter definition of what success is. Because for a lot of them, the idea is if we can just do Obamacare and then in a couple of years we have enough people insured, 25 more million people insured, and we can just call success, great. We can move on to other things. But you guys know that it's not going to be time to move on to other things. It's going to be time to get the things that are hidden here right, because they're the things that really matter. Thanks. I hope you guys have a great conference.
So when's the announcement? Hi, as you can imagine, we're running a little bit late, so we're going to go straight to the workshops. I think the workshops are going to be extended 15 minutes beyond the scheduled closing time. and that will still get us on time for the plenary during lunchtime. So thanks so much, and enjoy the workshops.